Hi, everybody. I'm really glad to be here. Dear family, faculty, graduates, thank you for being here. As a part of the public health community, I would like to start with a short story. In April 2020, a little bit more than 2 years ago, I was in Lima, Peru, working as a primary care physician, telemonitoring patients that were just diagnosed with COVID-19 and that were recommended for self-isolation. In the beginning, we were asking ourselves, what is this strange disease? We were clear about the recommendations to stop transmission chains. Almost every day, I was asking these patients to avoid contact with their relatives. But there was a big problem. Most of them were living in single-space house or room. So what was the use of my recommendations? If the living conditions, poverty, and the health system could not cope with that catastrophe. This was not unique to Peru, as we have seen in the US with the COVID-19 unequal burden. Now, after the rubble left by COVID-19, the world finally realizes the need for more public health professionals, like ourselves. Our role is more important than ever. And here we are, MPH graduates and everybody. After 2 years of pandemic disruptions, we are really a resilient cohort. Having most of our classes remotely and dealing with so many pivotal changes and crises in the world. Remember the PHI courses that brought us, many of us from different departments together? Who does not want to hear the word breakout room anymore? It's incredible how we were able to, even though through these dark and virtual times, create community and support each other. And I want to stop for a moment, and I want to give a big shout out to international students who made it and are graduating today. Graduate students, besides coping with COVID-19 related strengths, they had to deal with being far away from their families and home. They had to navigate a new society with new codes. They had to struggle with financial uncertainties, and they had to face with a system with only a fraction of the job and funding opportunities. How brave are you, international students, to endure these risks and challenges, particularly during these historical hostile moments in the US? Dear fellow graduates, one big message I would like to give to you is to never stop outraging and getting angry about how power is distributed in our world. Being scandalized about what happens in Ukraine, but forgetting what happens in other parts of the world, such as Myanmar, Yemen, or Palestine, blindfolded, omitting the many global injustices is wrong and a reminder of how mainstream narratives are shaped. There are still too many social justice battles to be fought. We need to act on all our fronts. From our own public health domain, it is clear how unequitable vaccine distribution was and still is a truly vaccine apartheid, whose public health, global health examples should not be repeated. The same is happening with climate change effects if we do not prepare in time. Though as negative as my speech could sound, I am full of hope. Hope from seeing all of you, outstanding initiatives coming from the School of Public Health, from brilliant faculty, students, staff to tackle these challenges both locally and globally. And I don't want to end without thanking the fantastic faculty, mentors, and staff who guided us through our unique journey. Also to our families and our here in the US and overseas, supporting our public health path. I am certain all of us will have a decisive impact in our communities, and quoting WHO Director Tedros Adhanom, I truly believe that together we can create a healthier world. Thank you.